My name is Alexandra Allen, and today I will be laying out some of the ways in which social insurance systems have perpetuated and enabled systemic inequalities, followed some by solutions and the potential future role of social insurance in a broader movement toward investing in community well-being. So let's jump right in. First, social insurance programs rely on the majority of wealth coming from income and wages. They use a flat payroll tax as their primary funding mechanism because that's how wealth was originally accumulated when they were founded. However, the reality in the United States has fundamentally changed over the last several decades, and social insurance systems need to evolve. Wealth no longer comes from jobs. It comes from stock portfolio interest, capital assets, and the accumulation of intergenerational wealth. At the same time, the market economy that social insurance was originally designed to facilitate has pushed cost of living ever higher while suppressing wages and consequently suppressing the revenues flowing into social insurance coffers. Over the decades, this dynamic has resulted in the financial insolvency of many earned right programs, as well as the insufficiency of benefit payouts relative to the cost of living. Even at fully funded levels, Social Security retirement and Social Security disability income benefits simply cannot cover average rent, utilities, and food in most places. It's also crucial to include that for many decades, social insurance systems implicitly and explicitly barred many Black, Indigenous, and other people of color from these benefits from their inception through employment discrimination, relegation to job sectors not covered by social insurance, wage inequality, and restriction on immigrants, all of which continues to this day. The social democratic bargain that Mr. Dion spoke of in his original essay has not been a good deal for all of us. And that was as true in 1999 as it is today. And this dynamic of financial insolvency and insufficiency of payouts with added burdens for people of color and other marginalized groups is frankly unacceptable. And the fact that we as a society have allowed it to continue for so long speaks to our incredibly skewed priorities. So with all of that historical context in mind, I want to move on to some potential solutions, mainly funding social insurance programs through progressive payroll taxation and wealth taxes, such as a capital gains tax. Now, I want to step back and recognize that the National Academy has traditionally maintained a more narrow definition of social insurance and its funding mechanisms, which does not include something like a wealth tax. But in the face of staggering inequality, which the pandemic has now expanded to include middle class and frankly, white people who were previously unaffected, it is time to think more expansively about what social insurance could be and how it could serve all of us. In order to fund the full spectrum of social insurance programs that we need in order to function as a society, we must have more progressive taxation and wealth taxation. This segues into a broader point I want to make. In addition to changing how we tax, I want social insurance to be part of a wider shift in how we invest those tax dollars, specifically the redirection of government revenues away from military spending and back into communities. We cannot continue to spend half of our federal discretionary budget on foreign military campaigns at the expense of Americans who are suffering for lack of basic social systems that we need in order to function. It's financially unsustainable and it disproportionately burdens marginalized groups. But we can change and social insurance can evolve. Think of what could be possible if we reduce taxes that go into military discretionary funding and instead increased a progressive payroll tax that fed into an earned right benefit to comprehensive healthcare, disability coverage, universal childcare, paid parental leave, and long-term care for our elders, all bolstered by wealth taxation. Take Medicare as an example. It is a widely popular social insurance program that could be expanded to cover most, if not all, Americans through a redirection of our collective wealth. This is a real option which has rapidly accumulated public support, especially amid the pandemic, and we have to seize this opportunity to transform social insurance to meet broader needs. To put it bluntly, I am tired of policy systems designed to facilitate and enable free market capitalism, the accumulation of wealth for the few, and spending on military campaigns. I want to invest in the health and well-being of people. Social insurance programs are imperfect, but they have the capacity to perpetuate systemic inequalities, but they also have the potential to remedy these issues and improve quality of life for everyone.